Okay. Hello, everyone. Welcome to our show today with our COVID update. I am so excited and pleased to introduce Patricia Tellez-Giron and Lourdes Shanjani. I'm sorry. I'm probably torturing your last name. I apologize. Uh, Patricia Tellez-Giron, doctora, will you just briefly tell us a little bit about your background so that our guests could kind of know a little bit more about you?
Yeah, so I am a physician with the Department of Family Medicine and Community Health here in Madison. I did my medical school in Mexico City and then came here and did a family medicine residency. And I have been with my department for the past 21 years as faculty. I'm also the co-chair of the Latino Health Council of Dane County and have been the co-chair together with Shiva Vidar-Silaf for the past 22 years. So I work a lot with the community. We have a radio program that we have been doing now for 17 years.
That is so beautiful. Thank you so very much. I know you guys from the Latino Health Council back in the day and all of the Latino Health Expo that you guys do every year. I love it. I mean, it's just been so amazing, the reach and the bandwidth that the Latino Health Council has given us. I was just if you haven't picked up your free mask at your local events, you will see these all around town every weekend at different venues. Arts in the Carts in the Park program is also hosting with the Latino Health Council. So I wanted to mention that. And Lourdes is new to your team. I just found out about you. Lourdes, that you came from Illinois. Would you share a little bit? Like, you have these letters behind your name, PHMDC. Besides just MD, what does all that mean?
All righty. Well, hi everyone. My name is Lourdes Shanjani, and I am a bilingual health education coordinator for Public Health Madison and Dane County. So you may be familiar with public health. We are the ones who help with the testing during the COVID, also help with the vaccinations. We are the ones who issue orders. So a lot of work there in public health. And yes, I just moved to Madison from Illinois, Lake County, Illinois.
Yes.
A few months ago, I started with Public Health Madison and Dane County last year. I'm going to be already 1 year in the job. Unbelievable. And I was also working for a health department in Lake County. I am originally from the Dominican Republic. I went to medical school over there and I graduated. So my background is in health. And once I moved here to Madison, I was just sharing how amazing the community is, but
Thank
especially
you.
our Latinx community and Latino Health Council have been amazing at just like welcoming me, making me feel at home, and we have been partnering and collaborating a lot to bring out information for our community.
Oh, that's beautiful. I love it. I love it. Love it. What kind of things do you see different here in Madison that you didn't see in Illinois?
You know, we've been talking about this in the past presentations. I think
Okay.
this county is a progressive county, but something that I really, really like is how organized our community is here. And, like having an organization like the Latino Health Council that helps everyone come together and, get information in the way that people are getting information in such a comprehensive way. I think it's just amazing, and that is one of the differences, because sometimes we do not see that in other
Right.
places, that organization and having that amount of collaboration.
Okay. That's beautiful that you're really digging on all of our calibration skills, collaborative skills that we have going on here in Madison. Thank you both for introducing yourselves. I just don't feel like I would have done the worthy cause of introducing yourselves in such a great manner. I've known Patricia forever. I can tell you that Patricia is es una doctora extraordinaria. Te puedo decir que, the Latino Health Council, when I saw them like over the weekend, like I said, in various fairs, giving away masks and really, and then the highlights that I've seen in the news, I was like, I got to talk to Patricia. We got to get the story about how Dane County has become the best COVID, vaccinated county for Latinos in the entire United States. I mean, am I right or wrong? I mean, I kind of feel like we're on that cusp. You were just saying that there are more Latinos that are vaccinated than in ratio, right, to our white counterparts. And what I mean by ratio, well, there's math, but basically we're not comparing oranges to oranges, but in a ratio, we're superseding the white population of Dane County in vaccinations. And I think a lot of it has to do with the buy-in that our community has in Dane County, the trust that we have, that the Latino Health Council by the individuals in that table, but also because of the actions that you guys have done. I mean, you guys were on the forefront with, there's been a lot of mental health crises, traumas that have been going on because of the raids and so forth just a couple of years ago. And I know that the Health Council was there, assisting people with emergency mental health counseling if necessary during those times. But before I digress to so many different things, I just want everyone here a lot of people are bouncing in saying hi to us. Gloria Lopez and Professor Beatriz Ali is also there too. So gracias por estar aquí con nosotros. But yeah, tell us about this journey. Tell us a little bit about this journey, Doctora.
Well, I think as you just mentioned it, I think we have had the success that we have had both with COVID education and assistance and now with the vaccine because of the trust and because of the job that we have been doing. Latino Health Council has been in existence for 25 years. And Latino Health Council is basically a volunteer virtual grassroots community organization, to the point that we don't even have a location. Until recently, we didn't have personnel to help us. Now we have Juan Carlos. But before, it was basically the job of like 5-6 people that were doing most of the things with the support of a lot of the organizations here. So thanks to that trust that we have been building over the years, that people see that we do things because we love our community, not because we have a stock on certain organizations, because they see that we're very honest, that we call things as we see them. So even if we have members in the council that we see things that are not working very well with that organization, we really advocate to change things with the organization, right? So thanks to that, I think as soon as this happened, we jumped on the media that we already had access to and started really communicating with our people. So day one, we started saying, this is real, be careful what to do. And we have now been doing this for a year and a half. And when I thought that we were going to be done, a couple of months ago, I'm like, okay, what are we going to talk about in the next program? Here we are, right? Needing to continue talking about this. It's also
you thought this was going to be done, Patricia. You really thought
about, doing the all this about the.
Because I thought it too, and I thought I was the only crazy one thinking that.
Yeah,
that
but
it was gonna be done
on the sense that we will have it under control, that people will get with the program, will get the vaccine, with wearing the mask when it was needed to wear the mask, that we will not have the mess that we have with the variant that we have right now. But I was wrong because I was trusting that people will have common sense. And we have proved that a lot of people do not have that common sense. That is, well, if the virus is still here, you go to a place that is so full of people, you don't wear a mask, you don't have a vaccine. It's just logic that you're going to have, COVID and you're going to increase the numbers. So that's kind of what is now. We are going backwards instead of moving forward with these things. And, the other thing that has been extremely helpful is the partnership. So as Lourdes was mentioning before, it was good that we work together in this community, right? That we communicate with each other, that as soon as this came to be, that we call upon different organizations
Yeah.
to help and to come together. And then the wonderful partners that I have in the council. I don't know how I will do it without my sister Shiva Vidarsi Laf, that unfortunately
I know
so
Shiva. Okay, you guys. So yes,
couldn't
we
be here.
didn't. Yeah,
Yeah.
Shiva couldn't make it with us today. So you're seeing Lourdes and Doctora Patricia and Doctora Lourdes con Araceli. Thank you here for our COVID update. We're going to talk about. We're talking about the journey of being like honestly a model for the rest of the United States on how to get a community mobilized for vaccination. And Doctora Patricia is telling us kind of step by step, like we're taking this way back to like 10 years ago. Like who knew like 10 years ago when the Latino Health Council was just like honestly something that you did during your lunch hour once a month and you were like, okay, what are we, what are it's a little granito de arena, this little piece of moment in time that we're investing. Did you ever think it would come to this, like where you're getting national recognition and you totally deserve it? Not just you, but the whole council deserves this. And all the partnerships, the grassroots partnerships that you've done with people, neighborhoods, community centers, agencies, businesses as well. All of us have something to say about that, but very much the people in our community who have, given you their trust. And so I wanted you to talk a little bit about that. You were talking about the partnerships and how incredibly important they are to having strategic partnerships. Can you describe a little bit like what areas do you guys focus on when you're talking about these strategic partnerships in the community that are going to help you cultivate that trust that, to get people to get vaccinated?
Yeah, definitely having the media has been good. So we have been doing La Movida, La Sabrosa, that has been amazing partners on talking about the education, but also knowing our community, right? So where is that our community is forced to go? So maybe they don't listen to the radio, maybe they don't go to Facebook, but they have to go to get their tamales and their chicharrón and their tortillas, right? So we partner with the Latino Chamber of Commerce and say, could you help us with the business so that we can advertise and put posters initially about education about COVID, about testing sites, and now about the vaccine. And then the Latino Children and Family Council that already also works with families. And then from there, all the other organizations, right, that say, yeah, we're here because we really want to help the people that we serve anyway. So that was just a natural way of reaching the people.
Beautiful. Right. And I remember too, you guys did some YouTube videos as well with DJ Payne. And so, I mean, you took on multimedia and you did it also like just taking it to the streets, meeting people where they were at, knowing where they would convene, taking advantage of those intersections of the population and where they go. And two, I mean, geographically, Madison is not LA, Madison is not Chicago. We're just a smaller size. So, I mean, I think it makes it to also put it in perspective of other crises going around the nation. That this is a smaller population, but that we're doing our best. Oh, Francis, Representative Wong is also watching. Thank you so very much. I mean, it is something that I know around the state. People are watching. People are hearing this, and they're like, "What? This is so great!" And we did this. I mean, all of us in the Latino community, telling our families, telling our friends, encouraging them. And now that we have this, it sounds like you might also have some information about this $100 that Governor Evers is providing, and I will put some links in the comments as well.
Yeah, I'll give some information about that, but also I just wanted to add to what Dr. Tellez-Giron was talking about regarding the collaborations and partnerships. I think that, it has been so intentional, the work that we have been doing to get the information out to our community. As she said, it's not something that everyone is trying to do the work and overlapping in the work. It's more like synergizing that work. And I think that having an organization that can help bring all the resources together is important. And also from a public health perspective, right? We talk a lot about like the power of collaborations and partnerships. And I think that everything we read and everything that was being said in the media. We were implementing here in Dane County, and that's why we have been having such a success with the vaccination rates. I mean, having the expertise of like a physician, someone that works in a health system, someone that works for public health, and having those conversations, not only for like big panels, but also smaller and more intimate conversations where people feel that they can come ask questions, they feel that they are being, listened, and they can get the information that is reliable, credible. It is
Preach.
very powerful. And I think that's where we have seen the success that we are having with those vaccinations rates, as Dr. Tejas mentioned. But of course, there's still more that we can do, and there's more people that needs to get vaccinated. Some things have
Yes.
had happened this week that hopefully we'll get some of those people that have not decided on whether to get the vaccine or not. One of those is that the Pfizer, which is one of the vaccines that was currently authorized for use, emergency use in the U.S., received the full approval from the FDA, from the Food and Drug Administration. So it is now a vaccine that is like fully approved for
Nice.
people 16 and older, right? Like the difference is that before we had that emergency use authorization, which again we can expand on that, and I don't know if this is the platform, but it was something that was, like research, and it followed all the steps. But now that approval, some people were waiting on that approval to take the choice, the decision of getting vaccinated. That's one of the things. The other thing is that the governor have an incentive program. He just released, sent out a press release yesterday about this, that people who will be getting their first dose, unfortunately, it doesn't count for us that we already got vaccinated, but hey, we want to get those people that haven't got the shot in their
I
arms
was
yet.
gonna say, can it be retroactive? Because I am standing to your Duluth. But here's the thing: I've already made my money off of taking my vaccine, and I'll say why. I know people have been like, "What are you yelling about? That you made money off of getting your vaccine already?" And and I know it sounds me oigo un poco chistosa, rara, lo que sea, but here's the thing. As a business owner, the moment I got vaccinated, fully vaccinated, okay, as a business owner, my revenue increased because I was able to finally do meetings in person. I mean, because
Mhm.
that's what I do, as an entrepreneur and a speaker and as presenter too. I'm doing that type of work out in the community, right? And so getting vaccinated as a business owner is like it's profitable. It is totally profitable. And this is what me da la angustia, me da un poco de coraje, right? Because I get a little bit upset about what's going on, the gaslighting that's happening in our communities of color, especially because we're already behind because of wealth gaps, education gap, etc. There's so many gaps in our communities already, and for people in our community not to get vaccinated, I'm just like, whoa, you're taking money away from your children, you're taking money away from yourself. I mean, like, fine, like, yeah. And so I'm glad that you're making it a point, Ludinus, that I'm like, okay, center myself, center myself. But I am so glad that you're making it into a point right now about this, that you're making it a point to say, you know, Pfizer is fully back now. Let's move
Mhm.
past the narrative that there was an emergency
Right,
order. It is fully, I mean, we're there. We're there since Monday. We've
right.
known about it since Friday. It's been released slowly in the press since Friday, about this, passing on. So we are as good as the measles now. We are as good as a tetanus shot now. These are all things that we've had to do throughout, the history of vaccinations in the United States. And so this
Yeah.
is, what do you, I mean, going on a sidebar, and I think some of the people I speak to are like, yeah, who are still resistant to wanting to get it. They're like, well, why isn't it mandated? I would trust it if the government trusted it. Can you speak a little bit about that?
I can start, and then Dr. Tejas, of course,
Uy,
he
sí,
can he
sí.
can add some of
Sí.
it. I think that Well, first of all, there are places already that are requiring their staff, their employees,
Right.
or even people attending events that they're required to have the vaccine. Um, and yes, some people might say like an order would help them make that decision, like make it mandatory, but um, I don't know if we need to get there to that point of making it mandatory. There are already the places like the public health department, for example. We are required to be vaccinated in order to work there. The university, the hospitals too. So there are so many places, and even if you go to an event like concert, there are concerts that are like for people that have gotten vaccinated and they have to present their vaccine card in order to get in. Dr. Tejas, do you want to add something to that about like why not make it mandated? What do you think about it?
Well, one of the big problems that we have had through this pandemic and maybe even before the pandemic
Please.
was the politics of it, right? We were coming already from a leadership that was a very bad leadership, particularly for communities of color. And then we get into this, and the leadership still made a point to make it a political issue very clearly, right? So
Right.
what happened that we started this pandemic with a divided country, right? We were 50-50, 50 that believe in one party, 50 that believe on the other party. And then they really truly believe what the leader will tell them to follow. So then we are still going under the same problem that a lot of the people that do not want to be told that this is mandatory are still going with nobody tells me what I do. Nobody tells me I need to wear a mask. I do whatever I want.
Right.
I have the rights, the constitutional rights. But people are not thinking that this is not about them. This is about us, everyone here, everyone in the world. So when you think only about you and your rights and forget about the rights of others, you are not doing the right thing. And I think a lot of people has to think it on that context that are uh, human beings are in the society, right? For us to thrive, we have to be in a society that has rules, that has rights, but it also has obligations with each other. And when you see it that way, then it's not an individual issue anymore, right? It's
Right.
not about you telling me what to do and the Constitution say that I can do whatever I want. And when we talk about people that are more vulnerable, that do not have a voice to be able to protect themselves, then it gets even worse. So when we're talking about kids that are not being vaccinated because the parents do not believe in vaccinations, and now we're seeing kids getting very ill, is
Yeah.
it something right or not to do this? And then we have the previous history, right? Schools have required vaccinations for a long time, and
Right.
nobody was saying anything. We will have a few parents that obviously do not believe in vaccines that will have an exception, but most of the kids in the school system were vaccinated before. So why is that we cannot use that to again say, well, this is just one more vaccine? Why are we separating this vaccine from the others?
That is
And
my question.
you
That is
know,
a good question. Yep.
so yeah,
And I
so
and I'm
we
sorry
need
to put
to,
you guys on the
yeah,
spot because you're the
yeah.
doctors. I'm sure you're just like pulling your hair for the politicians down in the White House to do what they got to do. I'm sure it's been a lot like that. It's like you're pulling your hairs, and I have a lot of love for you guys. I really do. I watch a lot of the videos, and I just like I cannot imagine to be always so much death, so much. We're over 600,000 right now, and 99% of those folks are non-vaccinated folks that have died. It just like breaks my heart. It's like you knew. I go on Facebook and I see some of my younger followers and women of color, señora, me rompe el corazón when they're like, it doesn't matter. I'm young. It doesn't matter. I'm like, no, but okay, but I don't know what to say. And that's why I was like before, I'm like, let me center myself because when we put it up, it feels very tense whenever I'm talking about it now that I didn't have that tension in me at the beginning of the pandemic. There was a lot of empathy, a lot of like, oh my gosh, abrazos, abrazos, pero no puedo abrazarte. And now it just feels like a lot of tension of like, this is my ideology, this is yours, this is, it's like, whose reality is like going to win? I don't, it almost feels like that a little bit at times. And then putting the, putting it back to the school districts, I believe has been detrimental possibly to Latino families in those areas because they have not been able to have that representation. If you're a Black or Latina parent of, or a parent of color in these districts that are mainly white, especially around Wisconsin, one, you're never welcome in those. You don't feel welcomed in those spaces to begin with, and then to go there and then advocate for maybe wearing the mask or against, perhaps it's still all a very intimidating process.
Mhm.
Yeah, but that's why we have to continue talking to our communities as a trusted source so that they feel supported, right?
Yes.
So that they feel that you are doing this for you, you are not doing it for anybody else. And by not following this, you are giving in into that government that has not been very friendly to us, right?
Right.
It's you're discriminating against your own self. So we have to be very clear that, for example, when the vaccine came to be here and we didn't have a lot of vaccine, we were already fearing that this vaccine was going
Mhm.
to go again to the white community. Why? Because historically is what happened, right? So we had to have advocates like Shiva, like Lourdes saying, wait a minute, our people has been affected disproportionately. You're going to have them first in line. And then not only having first in line, because some people say, oh, of course, they're going to first in line because they want to test it first. No, 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 no. We're
Well,
giving you
we're
the
first in line because we're the first ones to get out of the house to work for y'all and day. I mean, that's
exactly.
kind of
But,
the
but
reason.
we had to work a lot with people about that
Yeah.
fact. No, this time we are first in line. We have not been first in line with other things. Take the opportunity, trust the people that are putting us first in line.
Yeah.
And two, because we're
And
trying to earn more money. I mean, really, it became a situation of like, I get vaccinated, I get my job. I get vaccinated, I won't have to miss work for 2 weeks. For some of these families, that's what it meant, and it was like a cycle. It was just I would hear the stories from my friends who were working in the front lines. It's like if one person in the family got it, it was like boom, boom, boom. Everyone would fall eventually, and then everyone's
mhm.
falling off of work. And because if you don't have like the stability in the workplace, ya se te fue. I mean, that's it. And that's it. And that's for a lot of Latinos, and that's even Latinos first, second, third generation, regardless of their immigration status, we still have a huge wage gap. Latinas still are still the less paid population in the United States and the most represented in hospitality industry, restaurant industry, cleaning services industry as well. So we are always the
Mhm.
first ones in line. We were the first ones to get the virus, and we continue to be, impacted by this.
Yeah. And I just want to add that, that's what I mean when I talk about intentionality in the work, because we as people that are in these positions, we see the numbers, right? We see the statistics. We are in our positions advocating for the vaccines to be prioritized, or how do we make the process easier or less complex for our community. But then on the other hand, we are also out in the community talking to our community members and trying to educate them about the importance of getting the vaccine, and motivate them like, hey, we're making this available to you not because we want to test, right? It's because we need to get the vaccine. We are the ones, the frontliners. We are the ones who have been more disproportionately affected. So it can be draining at times because you are trying to balance, right? You're like, on the system side, trying to make some changes at that system level, right? Like, okay, let's make this easier. Like, how can I influence? How can I advocate? And then on the other hand, you go out in the community and you're trying to get the message the more simple for them to understand and to get them motivated. So it can get draining, and especially as Dr. Tellez-Giron said, when we thought that this is something that is going to be winding down, and it's not going to go away. We know it's not something that is going to go away, but that like emergency response that we have been in the past year, we thought that okay, now things are kind of like going a little bit more balanced. We're integrating this into our services. But what we have seen is actually a peak of, people wanting to get information, cases. It's like we're starting all over again, and
Ay,
and
how
you know
exhausting
it
it is.
it
Disculpa.
it can no, it can be exhausting, but we also want people to know that there are community members that feel very passionate about helping our community, and we are doing all that we can to try to get us to the level that we need to be. But this is something that not only affect our county, right? Not only affect our state, not even only affects our country. It's something that is worldwide, so it's bigger than that. But we all have to put ese granito de arena, like you said, and get vaccinated. And something that Dr. Tellez-Giron always says that I really like that statement. She said, getting vaccinated is an act of love. Es un acto de
Oh,
amor. We do that not only for
yeah.
ourselves, right? I'm going to get vaccinated not because Lourdes, I'm going to be healthy and safe. It's because Lourdes has children and I am part of a community and I
Right.
am going to do what I need to do to keep my community and put that little granito de arena to make things better in general.
Araceli,
Absolutely.
as you mentioned it, right? When COVID hit hard, so many of my patients every day, so many families, right? And then you know my mother. So when
Yes.
all of this started, my main fear is bringing this home, right? With the patients that I was working. So I almost didn't even want to come home because I said, well, if I get it,
Yeah.
that's different. I'm in this job. I know my risk. But if I give it to my family members, I'm going to feel horrible. So I have been doing everything, even if it's exaggerated. A lot of people say, well, why do you do it? I say, I don't care. I'm going to do whatever it takes not to bring this home, right?
That's because
And
so much we love our family. That's how you
yeah,
express your love to
yeah.
your family.
Yeah, but unfortunately, sometimes it's still hard for other people to see it, right? Because unfortunately or fortunately, we haven't had so many cases here in town where
Yeah.
families, complete families die. But definitely that has happened in other places where the full family went. It was just one member that even knew that was sick, that
Mhm.
didn't think they was gonna make anybody else sick, that just came home and everybody got it, right?
Yeah.
So I don't want to be a statistic. I don't want to be
Right.
there, and I don't want anybody in my community to be. So I always tell my patients when I talk about the vaccine, I'm talking to you about this because I care for you. I don't have a stock in the vaccine. I don't get paid to use more time of my time in the visit to talk about this. I do it because I care for you and your family.
Amen. No, gracias, gracias. Que hables así, Dr. Patricia. Thank you. And I just wanted to thank some of our viewers on LinkedIn. This is actually Lourdes. You didn't know this, Dr. Lourdes and Patricia, but we are doing something really virginal. This is like my first time doing a live on LinkedIn, and this is something that,
Oh,
yeah. So Midwest Mujeres, we usually just do this on Facebook and through our Facebook group. We have over 700 Latinas in a Facebook support group. We are entrepreneurs, wanting to close the gap on our professional development as well. And so we all, anyways, so usually I do it there on Facebook only, but this is my first time doing it on LinkedIn because I wanted to really share this great news of having, and boast a little bit something different about Wisconsin and immigrants. Usually it's the negative stuff, okay, and now we can boast about something really positive, which is leading the country and having the highest rate of vaccinations in a Latino community. Countywide, I believe we're leading that. And I can put some more articles there. Or just, go visit Dr. Patricia Diaz. You can just Google her name and it will come up. Like all of her beautiful magic and Shiva's magic and the Latino health puzzles. I know you guys don't do this alone, Dr. Patricia. I know that it is. You got a troop. You got a troop behind you. And todo un ejército, a whole army. And you guys can find, and I'm going to put them down, but you can find them on Instagram and on LinkedIn and on Twitter at Latino Health Council. And so, or Consejo Latino para la Salud as well. So I wanted to give out a shout to this organization that is celebrating their 10 years anniversary. And what a way to celebrate this. I was there in the beginning, and I can tell you, I don't think any of us ever thought
Araceli, it's actually 25 years.
25 years. Oh my God.
Yes, 25.
Okay, now we're really dating ourselves.
Yeah.
I know, I kept on
Yeah.
saying 10 years. I don't know where I read 10
I
years.
started when I was like 10 years old.
Yeah.
But
Oh.
yes, no, thank you. Thank you all. Okay. So we're getting some shout outs. Thank you all for, yes. I mean, my biggest want is for other people to get vaccinated, to understand that it's going to help you, it's going to help you in the long run to stay healthy. I actually get sick less. I mean, from what I know, that this vaccine is no different. It's more, obviously more effective, but it must be very similar to the regular flu vaccine that we was always encouraged but never did. I mean, am I right or wrong? I mean, like, how different could
Well,
it
it's
be?
similar to any other vaccine. Again,
Okay.
it's just what the media has been talking about this vaccine that has made it the bad vaccine for people that do not want it. But this vaccine actually has even less side effects than the shingles vaccine, for example.
Oh.
And when I recommend the shingle vaccine, everybody wants the shingle vaccine. But when I talk about the COVID vaccine, they have all these questions, right? So COVID vaccine actually is much more effective than even the flu vaccine. And it has side effects that are very common, for any other vaccines. So it's not really that different, but it's again what the media, what the politicians had made us believe. But I wanted to say that the way to address this with other people is with love and compassion.
True.
To try to understand where they are coming from. So when I have a patient, I do not talk to them in a tone of, I cannot believe it that you don't have your vaccine. You are getting us all sick. I say, could you share with me what questions do you have or why you don't want the vaccine? Well, I just don't want it. Oh, well, I just hope that you understand that, it's safe, it's effective. Yes, it has some side effects, but it's not different than others. And it's very interesting because when I start there, they notice that I am not going to force them to have it. So they actually start asking me more questions. And then they go like, so, and you got it, right? Yeah. And my mother, oh, your mother got it? Really? Is that safe? Yeah, my full family had it. Okay. And could I get it today? Yes, we can take you, and could you come with me? Some people have said that. Yeah, I'll go with you to the room and I hold your hand while you get the vaccine. Okay, I'll get it. But if I go to the other way, like, how come you are so selfish? I'm not going to get anywhere.
No, we're
So
not.
that's why I always go with the place from compassion and love and trying to understand where people are at, but really inviting them to ask their questions, inviting them to know the knowledge of what is safe. And I have had much more success doing that than the opposite. So I invite the audience that if they know anyone, just say, I love you. I want to have you around. I saw this program where they say that it's very safe. Could you share with me why is that you don't want the vaccine? Could I help you? Could I take you to the vaccine? Could I show you, where you can get it? And on that way, exactly, Xochitl is showing that we have a central number now that is actually my mom, 441-9918. You call
Okay,
and
I'm
you
gonna
can
call.
talk
I'm gonna
about
call
the
you. I'm gonna call
vaccine.
Yolanda.
You can talk about COVID testing. You can talk about your personal life if you need any ear that to listen to what is going on in your life. My mom is just wonderful.
She really
So,
is.
no barriers. You don't need to have documentation status to get the vaccine. It's free. It's in your language. You need transportation. We have transportation. So anything you need, you know where to find us.
Hmm.
There you
And
go,
to
608-441-9918. And you can speak to Yolanda Tellez, who, okay, so now that I have her phone number, I'm going to be calling.
Yeah.
I gotta catch up with your moms. I haven't seen her in a while, obviously. So I will definitely be calling and asking her, basically as somebody who, I struggle because I struggle in the sense of like, I don't know how to be nice. It may be with this. And honestly, I've been the quiet one. And it wasn't until very recently, I don't even think people even knew that I was vaccinated. I was just until very recently, I just started talking about it. And primarily, I started talking about it because of all of this negative stuff. But it's been hard because I notice as I talk about it, my energy goes up. I just start getting agitated about it. I haven't really told the people I love who I know aren't vaccinated to do it. I've told them very slightly because if I say more, I think I'm going to be aggressive. But I love I'm going to send them to you. Dr. Patricia, and follow and forever for those of us who are also struggling like myself. I mean, I think we can listen to what Dr. Patricia just said to us. Is the recipe is like asking questions. Why is it do you feel like this? Just
Mhm.
starting with that, with some empathy. Thank you, Dr. Patricia, for those recommendations, because I too have been a little bit struggling about that. Like, how do I talk about it without getting agitated about it? And I'm a survivor of COVID. Like, I didn't go to the hospital. I didn't have insurance though, but I promise you, I felt all of its pain and beauty for 3 months, and it was not fun, and it was definitely something that I lost body weight from it. I definitely was weak for 3 months because of it. We were financially strapped because of it. It was no joke. It was not. It was not a good time. I mean, I just like I don't know how to express it more than that. But that if I didn't have a place of employment that was understanding of my situation, I would not have had a job. And my husband included too. I mean, he was able to take 2.5 weeks. We both had employers that were okay with that. But other people, and other times of our years, we were both just looking at each other like, yeah, this wouldn't have happened 5 years ago. Like, if this would have happened to us 5 years ago, that's it. We would have been without
Mhm.
home, nothing. Like, this would have destroyed us had it not been for the employments that we had, the employers that we had. We have a question though. How can people find out about the vaccine clinics in the community, not just clinics? Oh, about the free vaccines that are going on.
That's a Lourdes is gonna give more information, but it's very interesting this question because when we started, doing the planning of how we were going to do the vaccines, immediately it was clear that for communities of colors, they do not want to get it in the street in a fair, that they will prefer to get it in a clinic because they feel safer that if something
Interesting.
happens, if you have an event, if you have a reaction to the vaccine, you are in a safe place. So from the beginning, Latino Health Council did not plan to do these kind of events. We have been participating and helping, but we decided that the central place to have it in a clinic where people already know, Wingra Clinic, where they know they are welcome, will be better. And that's why the strategy that we're still using, when you call 441-9918, my mom will ask you only your name, your birthday, your telephone, and then she will send this list to Shiva, and then Shiva will have their team call people in Spanish, offer transportation if needed, and then they can go to our clinic to get the vaccine. But Lourdes can talk about the experience with other venues that they have been also using with public health.
Yeah, thank you, Dr. Tejas. Public Health has two clinics that offer the vaccine on a regular basis, and that is the clinic on the South Park Street. And that clinic has the vaccine available on Wednesdays from 10 to 6. And then the clinic that is on East Washington, that one has it on Tuesdays from 10 to 6. So those are like standing clinics that we have. But besides that, we also have mobile clinics, and these are like in partnership with other community partners that want to host a clinic. They're usually open to anyone that would like to come in. um, we have been trying to do those in the evenings or weekends to try to accommodate people, and I can share the link to the map where people can just find where these clinics are happening. But as Dr. Tejas Hiron said, just like with the provider, the vaccine now is like widely available. It's not near where we were at the beginning of the year that it was so limited, the supply. Now we have vaccines available uh, virtually like anywhere where people can go, like a provider that can give them a vaccine. So,
Pharmacies too. You
mhm.
can go to a pharmacy, it's still free. in the
Mhm.
pharmacies. So now it's available everywhere, pharmacies, public health, through us. The advantage that we have been seeing with the way we are doing it is that people really trust to call a person that is going to answer in Spanish. My mom basically answered calls from like 7 in the morning to 10 at night, and Monday through Sunday. And then she make people feel very comfortable, answer their questions. So that's good. Margarita, with the question about people don't want to go
Yeah.
where there are so many sick people, actually, we have done a lot of education in the community about how clinics are reorganized and how until this day we have not been seeing patients that have respiratory symptoms. There are clinics that have been appointed to see patients with respiratory symptoms. We
Okay.
might start seeing patients with respiratory symptoms in the clinics in the future, but we have a protocol that is extreme on how we bring people to the clinics to be able to get that. So the majority of our patients that come regularly to our clinics have witnessed the changes we did in the clinics to keep them safe and to keep ourselves safe, because if we are not safe, we cannot continue providing for people. So most of the regular primary care clinics have been what we call completely clean, meaning we don't get patients that are symptomatic.
So there you go, Margarita. Thank you for that question, though, Margarita, because I do feel like that can be a hindrance for people not to go to a clinic because they're like, wait a minute, but there's a bunch of people that are sick there. If there's so many
Mhm.
people dying from COVID, could I get COVID from there? And I also want to say that I do believe are there still, Dr. Patricia, the drive-in vaccinations? I got mine in my car. There's not going to be no more. There's no drive-ins anymore. Okay.
No, because again, we thought that we were getting down and that we were not going to need to do this. And now we're seeing cases going up. So I think it's depending what the demand will be, that then we will have that. We also want
I
to
wanted my
remind
whole
people.
doctor life to be through a
Yeah.
drive-through. I wanted
So,
all of it.
so we want to remind people that we are still testing. COVID is still
Yes.
here. If you
Oh,
have
yeah.
symptoms, vaccinated or not, please go get tested. You can talk to your primary clinic. You can go through public health. You can go
Yeah.
to the pharmacies, the same places where you are getting vaccines. You can get tested. And please, 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 if you have symptoms, stay home, get tested. Don't go and infect other people, because we still have a lot of people that are not vaccinated or that are vaccinated that have problems, health problems, where their immunity is down, that you can still get very sick. So the worst that I could think of is that I go and I don't get that sick, but I get someone so sick that they
Yes.
die. I will never forgive me if I do that. So we have to think about that too.
We really do. We really do. Make that decision. If you're feeling a little bit ill, just stay at home. It might not be it. It might not be it. There's a lot of other things happening. There's a lot of other things going around. It is the seasons. One season coming in, one season coming out with those transitions. But like Dr. Patricia Sayes is saying, Dr. Lourdes, and we put them in the chat there. There's a lot of places where you can go and get vaccination. You can get tested. I believe there's rapid testing now available throughout our city at various locations. I think I did one. I got like a text within like a day. So the waiting time for your results are very fast now as well. And I just love that we went all all around the tours of the COVID situation. We hit the emotional stuff. It's about economics though too, and I don't want to lose sight of that. And that's kind of why I invited Dr. Patricia and Dr. Lourdes and Shiva. Why I've been so concerned as a business owner, and somebody that I would go to the Latino businesses and be like, hey guys, we gotta wear a mask, and encouraging everyone to try to wear a mask. And that's what I'm here for. And that's why I invited you guys all, because I'm like, I really feel that getting the vaccination has only helped my business grow. And yes, it's gotten me money. Because business was getting slower now because of pre-COVID times. And now that I have my vaccine, I have much more confidence in knowing that I did something right. And also that I can meet with people in spaces, people who are also vaccinated. Unfortunately, I do screen people who I'm going to do meetings with. But then there's how I get to do that loyalty. And I feel like I'm doing that for my clients, and also attracting that and encouraging that, and also people people are putting in there, thinking about how expensive the bill is for those of us who don't have insurance. And that's for anyone, first, second, third generation Latinos. Oftentimes we are working at places where they don't offer us full benefits, right? The reality of between being an immigrant or not, is if we're being Latino and brown and black in the marginalized communities, is not very big. So we are suffering from some of the same things. And so I just wanted, again, just give a big thank you to our health council, for our Latino health council there. And please follow them on social media. Check them out. They even have a YouTube video, you guys. They got a YouTube channel where they were doing all kinds of informational commercials. I saw those happening right away last year. That was amazing and fun. We're getting, Charles, Mr. Charles Tubbs there is also saying hello to us from LinkedIn. So I'm just excited to see how many people have popped in, and leaders in our community today have popped in and given us their support for this.
Yeah, I wanted to say Mauricio Nunez made me think of something. So he's asking, like, how expensive is the hospital bill? And then, Araceli, you mentioned before that you didn't go to the hospital because you were afraid. What I can tell you is that we are blessed in Dane County, and we are blessed to have systems that really help us, right? So I want people to know that if you are ill, please go to the ER. Don't stay home. If you die, it's going to be worse for your family, for the system. When you go to the hospital, every hospital in town has what is called community care. Community care will help you pay for the bill. So regardless of how much, particularly if it's an emergency, you can also apply for what is called emergency MA, and they will cover a lot of the cost of the visit, either at the urgent care or the emergency room. In Dane County, it is not a problem if you don't have insurance. Please go to urgent care. Please go to the ERs, and we are able to help you with the bills. But we want you to be well and that your family will be well. So please, if you are having problems, if you have COVID, you cannot breathe, don't stay home, because this virus, you get ill so quickly that you don't have an idea. So please don't wait until that moment. Go to the hospital, be checked. You have a bill, please call us, Consejo Latino para la Salud. We can tell you how to help you with the bill. And yes, systems in the United States are very, very expensive, but in Dane County particularly, we are blessed with having systems that can help us cover the cost of the visit.
You're muted, Araceli.
Sorry, I was just saying
That's
thank
okay.
you for encouraging us, for encouraging us that regardless of our economic status, that we need to get help, and don't let that intimidate you. The service, I mean, my gosh, to get on a ventilator, thousands of dollars, but don't let that scare you once you get sick. I think go to the hospital before it gets worse. You can be safe. There are people who survive this. I know I did not. It was more of, I was afraid to go to the hospital. Gladly I didn't have to, but had I thought I needed to, believe me, I was going to go. I will let Lourdes also speak about what kind of service, what do you feel like, what can people from other states take away from what we have built here on our outreach?
Yeah, that's a really good question, and I would just go back to what Dr. Patricia was talking about in regards to, just like the systems that we have in place here in Dane County that are supportive, the collaboration that is existing. Something really important that she mentioned is that she talks to her patients. She takes the time to talk to her patients, and we need more providers to talk to people and to encourage them to get the vaccine. We know that people want to hear from their providers, encouraging them to get the vaccine. So super important that other people outside, if they're providers that are watching us, that please take the time to talk to your patients. If it is a person that has gotten vaccinated, um, please talk to your loved one, to your neighbor, be vocal about the vaccine, do it with love, with compassion, with understanding, but share your experience, right? Like, how was it for you to get the vaccine? If you got any side effects, and those go away usually within like 1 or 2 days. So it is important for some people to listen to those experiences to ease and take some of that fear away. I did share a really good blog that we wrote about how to be a vaccine champion. It is in English and Spanish. So for people that maybe are feeling overwhelmed about having these conversations, there are some good tips that Dr. Tellez-Giron mentioned on how to, just like drive these conversations with understanding, with respect, being listening. And also, one last thing is that collaboration is the key to success. Making
Mm,
sure that we are all working
yes.
together, that we are not working in silo or duplicating work, but we are actually bringing, because at the end of the day, what we want is the well-being of our community. We all have that same goal, so why not do it together when we can have a larger reach and we can use better our resources. Again, like having a public health professional, a physician, and a representation from a health system, from one of the major health systems here in Dane County, in one room talking to people, just answering questions. That is very powerful, and we need our people to be empowered and have that information. So bring all of your resources together and put them to work towards that same goal that we all want, that is the well-being of our community.
Well said, Ludus. Absolutely, the key for all of this is going to be collaboration. And as you know, a lot of people like to listen and watch what I say, what I do, and how I rant and so forth. That's why I brought you guys over here, because I'm like, I honestly, none of this matters much to me if I don't have my audience healthy and winning with me, okay, with me, alongside of me. I'm not trying to be more than anybody else is trying to be. I just want people to follow their dreams and do that in a healthy manner, right? Where we can all win, and we have the informations and the abilities to do that together through collaboration. Well said, Lucas. I could not agree with you more. And that is why why I invited you guys today to come and talk about this subject. And so it's getting to the top of that hour. I love that we are such, a shining light for the rest of the country too right now, in a time when, there's not a lot of success stories. And this little town called Madison, Wisconsin brought over a success of over 60% of our population of Latinos are now vaccinated. And we were, there's been quite a there, I'm putting it out there. Currently, 60.4% of Latinx in Dane County have received at least one dose, compared to the 64 of non-Hispanic whites as well. It's very impressive. It's very impressive, ladies. It's good to be on top. It's good to be on top. It's good to be vaccinated. It really is. It's good to be highlighted in such a positive way. And I'm just three cheers for everyone. And, and with the numbers coming back up, I know that can be a time for us to be kind of like, oh man, como agüitarte, right? Get a little bit down about it, but don't. I think like Dr. Patricia was saying, we got to meet this with love and compassion. I know that's just like, thank you. Thank you so much, because I know some of us have been triggered, and there's been stuff going on both inside of our communities and our personal lives because of the COVID, and we just got to stretch it out just a little bit more, because I really do feel like we are seeing the end to this as well, if not, well, to the bell curve of it, right? Um, but without further ado, we've shared so many resources, but really our biggest resources are each other. So continue to collaborate, continue to talk about it, make it a point with your families to talk about vaccination, meet them with friends. We've learned today, okay, you can't be aggressive. We can't be aggressive. No los gares de la, ya no más de la chancla. Ya no les gares de la chancla, though I might follow somebody with a chancla very soon if they don't. No. Nada de que, un zapatazo, nothing like that. We're going to meet them with love and compassion. Dice Ludres, no, como crees?
No,
But
no,
that
no.
is not about us. So.
With love and compassion.
Yes.
Yes, yes. Well, ladies, thank you. Any last words that we would like to say to our audience?
Please get the vaccine if you haven't, for you, for your family, for our community. It is safe and effective.
I just want to say thank you so much for the time, for the invitation, and a really, really un abrazo grande para Shiva, que no pudo estar aquí hoy, pero she's like our powerhouse woman motivator. Y para Social, que estoy viendo que está escribiendo aquí, she's also like amazing to collaborate and partner. She has been just great. So please go get vaccinated if you haven't yet.
And
Absolutely.
my sister that has been amazing, Teresa,
Yes.
I love you. Thank you for all you are doing for everyone. And my mother, Yolanda, I cannot thank her more for what she's doing. So all of us, thank you, Araceli, for having us here today.
Sí, de nada. Adiós. Hasta luego. Bye bye.